Hey everyone, this is Tanya Osborne, Director of Community at Women Grow. I am actually geeking out a little bit because when I came to Women Grow, what I was really most excited about is being able to meet all these women leaders and entrepreneurs. And when I ran the New York market, I had the opportunity to meet Dr. Paloma or Dr. Paloma Lehfeldt. And it was just so great to be able to talk to a woman doctor about the things about cannabis and having like the science behind it. When you're a consumer and you just want to learn, it's so fantastic to be able to talk to. So now, but we've never done this type of like chat, like where we're able to sit down. So I'm really excited to do this. So please allow me to introduce Dr. Paloma Lehfeldt. She is the Senior Director of Clinical Science and Partnerships at Goodness Growth. And I am very happy that you're here. Thank you so much for joining me.
I am absolutely thrilled to be here. I've been in the industry for a few years now, but Women Grow is one of the first organizations that I said I need to meet these women. I mean, truly amazing what you guys have done over the past years, and just so excited to be here. Tanya, thank you so much for having me. I have to quote you and saying, this amazing quote from a few weeks ago that doctors are the gatekeepers to the stigma. I couldn't agree with you more. Like myself, none of my colleagues in medical school were ever taught about cannabis as a medicine. And it's completely unfortunate that we're still talking about this today. So thank you for providing a platform to really spread the amazing cannabis plant, the medicine, and how many conditions it's really used for. Thank you.
Thank you. Thank you. So I think what would be a good talk today would be, New York is really we're really starting to get close to adult use, but it's still a ways away. So our option to purchasing legal cannabis right now is via the medical program. And I come from the patient community. I was a caregiver for my uncle when he had cancer, and he used cannabis with his traditional medicine, and he had great success. So I am a patient advocate, 110%. So I do feel the need for medical in an adult use market. And I know a lot of folks are like, well, I'm just going to wait. Or I'm, now that it's adult use, why bother becoming a patient, And I, because I know some stuff, I think, and I want to, help you validate my reasoning for why there's still a need for folks to become a patient. Right? It's still a need for people to become a patient.
Yeah, I absolutely. I'm a huge proponent of getting your medical card, regardless of the legality in individual states for many reasons. But talking about medical just a little bit, I mean, cannabis is relatively benign compared to our traditional single agent pharmaceuticals. However, there are particular populations that should not use cannabis, and there are very few of them, right? Pregnant, lactating, first degree history of family history of psychosis, someone with severe cardiopulmonary disease. But there are also a lot of individuals that are on a bevy of pharmaceuticals, especially some of our elderly patients who are on over 10 different pharmaceuticals that really need to have that healthcare provider's touch, because there's something called drug-drug interactions. And the cannabis plant interacts with how we metabolize our different pharmaceuticals. So it's imperative that we have that doctor or that physician's assistant, nurse practitioner that's really able to sit down and work with you and really cater to your individual endocannabinoid system, your individual physiology, to really find the best dosage, the best form of delivery, the best ratio of cannabinoids, all these things that you might not necessarily get to talk about if you're just going into a dispensary without that knowledge. So it's absolutely imperative that we have the healthcare provider there. I kind of talk about, analogous to if you have a cardiovascular disease, if you have high blood pressure, you don't just go to CVS and pick out whatever you want from the aisle, right? You sit and you talk with your doctor.
Wait, can you say that again? That was too good.
I want to do webinars with you every day because you're my husband.
Well, that is great. You don't just go. Right.
How would you know what dosage of your antihypertensive medicine to take? How would you know how that antihypertensive works with the other medications you're taking? How would you know what time of day to take it? How would you know how many of those pills to take? You don't know. And unfortunately, when I acquired my hundreds of thousands of dollars of loans in medical school, I'm able to kind of walk you through that. And your healthcare provider, who is pro cannabis, who is a certifying provider, will be able to really guide you along your cannabis journey so that you don't have to walk in and just buy something that you don't know how it'll affect you. And exactly.
Right. Talk about another reason to get a patient, to become a patient or stay a patient in an adult use market. Another reason would be, what about taxes? Can we talk about taxes?
Yes. Medical is number one. I'm always going to say that's number one, but absolutely. You are going to save a lot of money by still getting your medical card in most states. And that's because adult use consumers are going to be taxed, sometimes heavily. In states that have just, welcomed adult use, such as Arizona, which is a great example, a lot of people continue to get their medical card because they're saving a significant amount of money. I'm talking, people in the adult use market can be taxed anywhere upwards of 20 to 25% of their purchases, which is inane. And not only that, but the milligramage of the amount of cannabis they're able to purchase is significantly lower compared to those in the medical market. And that's incredibly imperative for folks to have that high milligramage if they're suffering from chronic pain, palliative diseases, cancer, and many others. Absolutely. They can't have that 10 milligram THC cap that adult use patients might see, and they need that. And then we talk about forms of delivery. Adult use patients are really limited to forms of delivery. Medical patients have that suppositories available, those gel capsules, more medical ways, as well as traditional combustible formulation. So it really is limiting to become to switch from medical to adult use. And we've seen in the markets in which we operate that people really remain in the medical market for those reasons.
I love that. I love that. So let's continue talking about medical, because that's really the issue. I was a caregiver for my uncle. I don't think my uncle would have gone to a traditional adult use dispensary because he needed that contact. You know what I mean? He needed someone to answer his questions. And I think, like you said about the high blood pressure medication, why would you even not consider speaking to a professional?
Right. Absolutely. You absolutely need that touch in order to really have the best experience. Again, it is overwhelming for someone who does not know about cannabis. You cannot just walk into a dispensary and get something that works for you specifically. It's just not going to happen if you really don't have that touch. We talk about different cannabinoid levels, different terpenes, different strains, different forms of delivery, the way it affects men and women differently, our own pharmacogenomics, which are the different ways we metabolize. So really not having that.
That was a big word. That was a big word.
It's like the 23andMe for cannabis, right? We all have a different genetic makeup that has to do with how we metabolize cannabis differently. So something that works for you might not work for me and vice versa. And it's incredibly important that with regard to our THC dosage, if that's what we need, that we're really starting low. The worst thing that could possibly happen is someone that's coming into a dispensary for the first time, a new user, as an adult use patient, is taking something that is way too high for them. And they have a horrible experience and really never come back to cannabis at all. Again, it's why it's so imperative that you have that healthcare provider touch. And it's the same thing with all different, new things that you're putting into your body. You really need to have that background and learn how it's going to affect us all differently, because it does. All of our endocannabinoid systems are so different. Gender, age, drugs we're taking, history of cannabis use, other substances we might be taking. And if we're not really, learning about how it's going to affect us, we're not treating our diseases or our ailments in the best way that we possibly can. And Tanya, you mentioned chronic pain. Chronic pain is something called a multifactorial disease, right? You don't just have the pain. You have difficulty sleeping. You have insomnia. You have depression.
You are not incorrect. You are not incorrect.
And now New York has opened up the medical program to not be so restrictive with a specific amount of diseases, because insomnia, especially, talk about the pandemic, who isn't suffering from sort of insomnia, right? Regardless of chronic pain. But before this expansion of the program, insomnia was not a qualifying condition.
Right.
Which is a disservice, but now it is. And if we're going to go insomnia, we've got to talk about mental health too. Right now there are 1 in 3 people that had COVID have a new onset mental health disease. This was a poll that went out. And, rather than just pumping everyone full of pharmaceuticals, which do work for people, right? SSRIs are great for some people, but we need to really make sure that we have our psychiatrists on board as certifying providers, so we can get all of our new onset anxiety patients, new onset PTSD patients, the proper cannabinoid medicine.
And that they're working with someone, because that, again, is something that's frightening to venture in by yourself. You may have heard something works and then you try it and then you don't have the best experience and you're not been supported. You know what I mean? That's not a great thing to happen,
Absolutely.
What would you say to a person? We're in New York. We are the largest consuming cannabis state in the country, I am told. And let's talk numbers. We really only have about 160,000 patients in the program currently. I think because most people don't know. I've had many conversations up until a few weeks ago where someone didn't know we had a medical program. But now everyone's, becoming more aware because it's in the news. New York State is going adult use. For someone who has been able to get their medicine through our lovely legacy market, what would be the enticing factor to have someone become a medical patient?
Sure. Again, that extra touch that you're going to get, that doctor that's really going to be supporting your endocannabinoid system along your journey. There's also going to be home grow with a medical card that people will be able to really have their own medicine at home, especially for patients that maybe have anxiety and don't feel comfortable going to the dispensary. They'll also be involved with the caregiver program, which I know is incredibly important to both of us. And then having your card also provides some security with regard to legality. If you have a medical card, it makes you, legitimate in some law enforcement's eyes. We know that, Black people are 4 times more likely to still be arrested for cannabis. So having that extra backup and having your card, again, from that aspect is incredibly imperative. And of course, we already talked about the monetary side of things. You're going to save money in the long run because of taxation once the adult use market opens up. So there's so many reasons to really be in the medical program. Again, number one, just having someone that you can talk to if you do have an adverse event, if something does not go right. And then just to really, journal and have someone, again, having that same analogy to not just go, it's not even going and having the antihypertensive medicine when you have high blood pressure. It's going into a pharmacy and not knowing what to take for your high blood pressure.
Because there are more than one type of medication for that.
Yes.
So before we jumped on, we had a little brief conversation, and I didn't even think about this. There are populations that truly require that medical touch when it comes to cannabis, and one of those populations are children. So if you have a child that uses cannabis for any type of their condition, they need that extra touch as well. And I think that that's something to consider, because I know CBD is used. I use CBD for my son when he had those growing pains. He had a little scoliosis issue, and that helped him, and it wasn't legal. So I actually am going to be honest with you. I was like, just eat this gummy. You don't know nothing about it. It doesn't, because I was, it's something to be concerned with, Teachers don't really understand that. So I think if your child can become a medical cannabis patient. And I don't think a lot of people even consider that. And I think that that's something that we should talk about.
We should talk about it. In the adult use market, it's only 21 and over. So this is including pediatric population.
It is 21 and over.
Our adolescent population. Cannabis has been shown in countless research studies to be incredibly beneficial, CBD specifically for pediatric epileptics The FDA actually synthesized their own cannabidiol to use for three particular pediatric epileptic populations. It's also been shown to be amazing for autism spectrum disorder, as well as a variety of different mental health disorders in the adolescent population. Again, I'm going to bring it back to COVID. These adolescents have been isolated from their peers for 2+ years now. There is new onset adolescent mental health issues, and having that medical program be available to this particular population is so imperative. We could talk about this for on its own, because now more than ever, we need other options for adolescents besides traditional single agent pharmaceuticals, especially for mental health issues, which we're really going to see an uptick in over the next few years.
And then I think lastly, there was the other population was folks with disabilities who can't get to a dispensary, or really, again, need. So the bottom line is really that extra touch, that extra health person, that you need a doctor, you need a nurse, you need someone to ask those questions. If you're really using cannabis as medicine, that is really, that's the value add, is the being able to talk to a doctor.
Absolutely. We need to treat cannabis like we're treating all other medicines. We really do. We need that touch. We need that extra care, and we need that legitimacy. And because of the stigma that's out there, unfortunately, we don't have that yet. But it's forums like this and avenues like this that really destigmatize and make it not this, this taboo topic that we talk about under our breaths.
Yes, that is how we get rid of the stigma. We need to get rid of the stigma.
Absolutely.
And honestly, now that the changes, and then we could wrap up with the changes, and you're being able to get your medical card for conditions, not specific conditions. I hope that more doctors take the time to educate. But I think as a patient, I'm going to start having more conversations with the doctors that I know, the doctors that I visit, about them upping their knowledge around cannabis, because if I want to have those conversations, I want to have them with my doctor. So my doctor needs to get on it, right? Am I wrong?
No, let me talk to your doctor, Tanya. Absolutely. Patients need to be their own advocates here, because again, doctors don't have the knowledge. Not all doctors have the knowledge, I should say. About 13% of medical schools, from what I hear, teach about medical cannabis. I actually think the number is a lot lower from just being out there. But there is enough research out there. Again, cannabis is Schedule I, so there isn't a lot of research in the United States, but other countries like Israel, Uruguay have been doing this research for decades now. So there is peer-reviewed research out there. I have, stacks and stacks of it that I put out all the time. But really bridging that gap, ending the stigma through education like this is imperative right now, especially as we start to transition state by state over to adult use. The need for the medical market is still a necessity, for sure.
Absolutely. So just make sure we held everybody, making sure that they put patients first. We're using cannabis as medicine. Patients need to be first,
Absolutely.
And we got to get more doctors on board. And I think this conversation was fantastic. Dr. Paloma, thank you so much for joining me today. Please follow Dr. Paloma on all her handles. And we're going to be doing some stuff in the future, and I'm excited for that. And thank you for joining me.
Thank you so much for having me. Appreciate it.